All right. Good afternoon, everybody, and welcome to the April 8th edition of Nevada County Vaccine Update. And I am joined by the four luminaries of public health, and very glad. And I will hand it off. Who wants to start out to give us an update on, well, where are we today?
Ryan, you're the answer man, aren't you?
Sure, I can give you some quick numbers and then turn it over to the public health team to fill in the gaps and answer any questions. So as of today on the state's dashboard, there are 54,108 vaccines administered to Nevada County residents. Given that that's mostly two-dose vaccines, by our calculations, around 40% of our population over the age of 18 is at least partially vaccinated at this point. We are, although our numbers are ticking up, we're starting to see the impacts of vaccination play out in terms of who is coming down with COVID. So far fewer of those are occurring in healthcare providers and people over the age of 65 who are among the first to be eligible for vaccine. So that's evidence that the vaccines are working. And the fact that we're seeing more younger cases is one of the reasons why our public health team was able to open up eligibility in advance of the rest of the state to 16 and older at our Whispering Pines clinic. And anecdotally, both the appointments filled up pretty quickly, and I've heard from a number of community members who took advantage of that access to vaccine. And so that's great news. I want to emphasize a little bit before turning it over how to get vaccinated, because there's still some confusion about that, and people that have signed up for My Turn who expect that means that they're getting an appointment or somebody's going to call them. And so there's two main ways to get vaccinated. One is through the county, and right now we're the only provider working in My Turn, and I want to make it clear that if you've signed up for My Turn, you still need to go back and make an appointment, and we post appointments on Fridays at around noon. So go to My Turn at Friday on noon to make your appointment at our Whispering Pines clinic. And then the other way is through our network of vaccine providers. And so if you go to our website, mynevadacounty.com/coronavirus and click on the vaccine link and go to our Get Vaccinated page, we have a list of all our providers, who they're vaccinating, and how you can sign up when there are appointments available. But I just want to emphasize that it requires proactivity, and having signed up for 211 or signed up for My Turn doesn't mean that you have an appointment. And then to all those who are sitting on the fence, who are hesitant about the vaccines, I just want to reiterate 54,000 doses and very few, if any, severe reactions. The vaccines are highly protective. Get off the fence and come get vaccinated, because that's our ticket out of this.
Hey, Ryan, may I make one clarification?
Sure.
So Dignity Health is also on My Turn. So yeah, Dignity Health Medical Group is on My Turn, and I think if you go into My Turn today, when I did this morning, they showed up as an entity with appointment. So I don't know if those are filled up now, but I believe we have 2 providers on My Turn in the county now: Dignity Health, Nevada County Public Health, and more to follow.
Awesome.
Great. So let's see here. I got a few questions in advance of today's webinar. And so the first one is like, why are the COVID cases in Nevada County going up? For so long, we were below the average for California. Now we're higher. So what's happening?
I think Glennah has the best answer. We just talked about this before we came over here. I don't know, Glennah, Dr. Trochet, if you want to take that one.
Well, we clearly are gathering too much, and we're not following the masking and social distancing rules. If we were, our numbers would be down. So I think it's fairly obvious why our numbers are up. We need to vaccinate more, and for those of us who, even if we're vaccinated, when we're in public, we should be wearing masks and social distancing. If we do that, our numbers will go down.
And I would like to add that people from Nevada County who go to other counties are quite shocked when they return. You could even stay in the county and come up. I'm in Trochet right now. Every place I went had a mask. And it's not the same in Western Nevada County. So you can either compare Nevada County to other counties, or you can even go across the pass into another part of our county, and you can see how people are ascribing to the guidelines. I mean, it's real simple. We've known how this virus has spread for a long time. We know how to prevent it. It's just we need to, ascribe to what public health and CDC guidelines are, and our case counts will go down. And if we don't, they'll go up. It's real simple math. It's not rocket science.
And as follow-up to that, the other next question is, in general, where are people in Nevada County catching COVID? Is it social gatherings, in homes without masks? Is it outside?
I don't think we have an indication of indoor, outdoor, and we've seen it in workplaces, in schools, in gatherings. It's really across the board. It's so peppered. It's hard to say it's one thing or another, or that there's one thing in particular that is leading to this. It's again, we're seeing it throughout the community. We know the red tier indicates substantial transmission. The purple tier indicates widespread transmission. And our data qualifies us for the widespread transmission for a reason, because it is indeed widespread right now. So again, we can't say it's happening indoor, outdoor, but we can say it's happening across the community in virtually every setting, every type of setting.
Certainly studies have shown, not only internationally, but nationally, and even in California, that, indoors, poorly ventilated, without mask, are the prime movers for this disease. Outdoors, less so, and of course, masks prevent it quite substantially. So bars and gyms and restaurants and even places of worship, would say that even places of worship, it's not when you worship, because I've been around to a few of these institutions and they're pretty safe, but before and after, there's gatherings, and even people after place of worship service is over, they'll gather indoors, and and that's just prime for passing on this virus from one to another. So we do know in general the areas where it's passed. Specifically where in Nevada County, it's a little hard to point fingers because people go to multiple venues probably in the same day, and it's hard to pick up exactly where, but certainly we know from a lot of research, these are the areas that are traditionally passed.
And then, of course, the next question is, why should anyone care that we might be going back to purple? June 15th is going to open up everything, and there's no enforcement anyway. So why do we even bother going through the tiers?
So I don't think anyone should assume that there's no enforcement. That's not accurate. I think one of the things that we've learned through the pandemic is that enforcement is complicated. And so I just want to clarify that, I don't want anybody to be under the impression that there's no enforcement. And given our increase in cases, it's quite possible that the state will take more of an interest in what's going on here. And they have some tools that are stronger than what the counties have. So, but in terms of why people should care, the same reason we should have cared throughout this, that people can get sick and die from this. And unfortunately, 75 of our residents have lost their lives as a result of COVID. And it would be a shame to see another spike in deaths before the state opens up the tiers and after.
Yeah, I would like to echo what Ryan said. In addition, you're really playing Russian roulette with your health, because if you get the infection, yes, it may be just as simple as a cold and you get over it and you feel fine, or you may end up with long COVID with symptoms that go for a long time, or you could end up hospitalized. Your lungs could be totally ruined, you ending up with a lung transplant. And there have been several people who have gotten COVID that have ended up needing lung transplants. So I think we should care regardless of what tier we're in. We need to protect ourselves, but we also need to protect others.
I would just compliment that and say that there are people in the community who look to see which tier we're in, because that indicates to them how they should be interacting within the community. So if they see that we have a substantial spread versus a widespread designation, that communicates something to them. That might influence how, again, they're living, working, playing, worshiping in this community. And so I think that that's another value of the tiers and the color-coded system, is it's an indicator to people about what's happening in the community, and those who want to take precautions know when to do it and why.
And Ryan, I think we have another question, but more a statement from our 211 partners that say Documus Pharmacy website says they are moving to My Turn for appointment scheduling.
I indicated I would like to answer this just because I want to clarify when I said we're the only one on My Turn. All providers will eventually be on My Turn, and that'll be a great change because that'll be a single source where people can go to sign up. And so as Jill indicated, Dignity Medical Group is now on board in My Turn, and that's fantastic. And if Docomo's is getting there soon, that's just going to simplify things even further. So that's exciting progress.
And then should people missing a spleen get vaccinated? And if so, which vaccine?
The answer is yes. And the next one is any. Real simple. Being splenectomy, having your absent spleen makes you, a little bit more, immune compromised, and certainly you should be immunized. And any immunization works, similarly to help prevent COVID-19. So yes, and any. That's the answer. Get an immunization, and any one you can get is good.
Great. And got a couple questions via the 211 call center asking about if the J&J Johnson & Johnson might the Johnson & Johnson supply chain be different for county public health versus pharmacies and federally qualified health centers? And do we know if there is more Johnson & Johnson coming into the county, because of course it is the single dose vaccine?
Yeah, we know that that there was a problem with some of the Johnson & Johnson vaccine that was in the news, and the state of California is getting less Johnson & Johnson vaccine than they had anticipated. So pharmacies got quite a good, I was gonna say dose, but they got quite a bit of Johnson & Johnson from the federal government. So if you can find a pharmacy that has it, if that's the vaccine you're seeking, that's great. Again, we're going to see less coming into California, at least for this week and maybe for a couple of weeks. Nevada County Public Health, we found out we're getting 100 doses more. So not much, and but some. And again, we're expecting to see a decline in the amount coming into California this week, probably for a few weeks. But prior to that reduction, the pharmacies that are part of the federal pharmacy partnership program got quite a bit.
Great. And how effective is one shot of Pfizer? Or one shot of Moderna for that matter? And should you even consider just getting one shot?
The research seems to indicate that you need a booster. It's fairly effective, probably 50 to 75% effective 2 weeks after your first shot. It is assumed that your immunity will wane. There is a proviso, and I think there may be some recommendations coming out of the CDC. If you've had prior COVID-19 and then you get one shot, your immunity is boosted, quite substantially. They may come out with some other recommendations, but right now, if you want to be protected, you got to get 2 shots of Moderna and the Pfizer and one of the J&J.
And are we having any fully vaccinated people in Nevada County get sick with COVID?
Glennah?
Yes, we have had several people who are fully vaccinated come down with COVID, and that is expected. In the real world, these vaccines are about 95% effective. So 5 out of 100 people who are vaccinated still might get COVID-19. We are identifying it mostly in healthcare workers, because whether they're vaccinated or not, healthcare workers continue to be screened for COVID-19, mostly on a weekly basis in most facilities. So we're detecting it more in them. So far, anybody who's been fully vaccinated who's gotten COVID has had mild disease. Certainly we have had no one hospitalized. And that is what the vaccine does. It does, even if it doesn't protect you 100% from infection, It does protect you 100% from hospitalization and hopefully from death.
And that is it's so important to reiterate that even if it doesn't 100% protect you, you won't end up in the hospital on a ventilator. I mean, that
Right.
alone is probably reason enough for most people to actually get it. And are we identifying variants? So as far as I know, at least one. So can somebody tell us the variants and also just for maybe for people who don't live and breathe COVID all the time, how do these variants occur? What's a variant? How does it get? And do we identify them?
Okay, first of all, when we get infected with this virus, the virus converts our cells into virus factories. As we get sick, the virus replicates millions of times inside each body. And so in the United States, we've had 130 million infections. Just imagine how many billions of times this virus has replicated. And each time it replicates, there's an opportunity for the RNA to make a mistake. And so the genome of that virus changes. And occasionally that mistake actually works in the virus's, it works to the virus's benefit. And it becomes one of these variants that is more transmissible, that might cause more infection, might cause more illness. And so that is why we get variants, because the virus has had the opportunity to replicate so many times that different forms of the virus can be created. So that's why we have variants. And so the question is, because we've identified a variant in Nevada County, many people are asking, how many times do you test for this variant? For variants in Nevada County. And let me explain that we try to get whole genome sequencing through the state lab on all cases that we suspect are either a reinfection, somebody who had COVID and then gets it again 90 or more days after they had the first infection, or anybody who's fully vaccinated that then tests positive for COVID-19. We try to get this whole genome sequencing. But in order to get it, lots of things have to go right, and they don't always go right. We have to know about the case in a timely way. It has to be within 1 or 2 days of infection. The specimen has to be available in the lab, and because so many tests are done, the specimens aren't kept very long in the labs. The cycle thresholds have to be low enough, because if it's a high cycle threshold that can't be tested for sequencing. The lab that ran the specimen has to be willing to ship it to the state. The individual who is sick has to be willing to cooperate with us to give us the information we need to send to the state. If all of that aligns, then we can send the sequencing to the state. Because there are so many tests being sent, after all, we have 40 million people living in California, the test results take a long time, 6 to 8 weeks before we get the test results. So yes, we tried with every one of these. We were successful this one time in getting this specimen tested.
California's increased their random sequencing from 3 to 5%. They're only 6% now, but we probably sequenced only about 30,000 specimens of things that are of viruses that have been shown PCR positive. And so they're ramping up the capabilities, but if you ask how many variants and what variety they are, it's a little hard to ascertain right now. We do know there's variants, and the one we found is the California variant. I think it's was it 429 variant, and then but the B117, the British variant, is just got to be here. It's actually quite more common than the one we found. The problem with variants right now is that it's more resistant to treatment. So the monoclonal antibody treatment and remdesivir, the antiviral treatment, it's a little more resistant to that. It seems to be a little more infectious. We're not sure exactly why. Maybe it lasts in the body a little longer. But they all seem to be, vaccines seem to prevent all these variants. So the good news is get vaccinated and you won't have a variant.
Basically, if you get vaccinated, you are reducing the pool that where the virus can go replicate, and then like videotapes for people who remember those, who when you record over and over, eventually, well, then the quality is not so good and there will be mistakes. So that's pretty much. So let's starve the virus by getting vaccinated. Would that be a correct statement?
Absolutely, and not getting infected. If you haven't had your vaccine yet, or you're not fully vaccinated yet, don't be out and about. Wear a mask, social distance, because if you don't get infected, the virus doesn't have the opportunity to replicate.
And speaking of masks, we have a question from Karen, who's asking, the CDC recommends double masking due to the new variants. Do you think double masking is necessary if one is fully vaccinated, or is a surgical mask enough?
I personally wear a surgical mask when I'm out and about. I am fully vaccinated. I think people should do what makes them feel most comfortable. Certainly the double mask helps adjust the mask to your face so that the seal is better. For some people, it's harder to breathe through two masks. So again, as long as you're masking and you're social distancing, I'm not sure that it makes a difference whether it's one or two, but I'll defer to Dr. Kellermann. He may have another opinion.
Well, if you got an N95 mask, then you should not put a mask over it. But basically, the surgical mask is perfectly adequate. And the cloth masks work too, just not quite as much as a surgical mask or N95. But I agree with Glennah. Just wear a mask and we'll be happy at public health.
I add something non-medical to that. It took me a year of the pandemic to discover this, but I found that double masking is the only way for my glasses to not fog up. So just a pro tip.
And it's definitely worth, because it's for people that wear glasses, me included, the fogging up. There's all kinds of tips and tricks so that your glasses don't fog up. But we're at least we're getting towards spring and summer, so it's going to be less of a problem. Back to the variants. Are there different or additional symptoms associated with the variants? In other words, if you feel sick, can you or can a medical professional ascertain if you have a variant without the testing?
I don't think so. I'm not aware of any symptom that's worse with a variant than without. Without the sequencing, I doubt very much that we would be able to determine that.
It can't be determined clinically, only through labs. The symptomatology is the same that one could expect with a non-variant type of COVID.
And a question about, well, vaccine shopping. If an individual wants a specific vaccine, is there a way for them to request that vaccine, even if they have to travel to get it at this time?
I think someone would just have to know what vaccine is being used at which clinic. So for example, in Nevada County right now, our Whispering Pines Clinic and Docomo's, we're both using the Pfizer vaccine for those clinics. Pretty much every place else in Nevada County is utilizing the Moderna vaccine. When we create our clinics in the MyTurn system, we put the vaccine type next to the clinic. So somebody can see before they schedule an appointment at that vaccine clinic which vaccine is being utilized. And I don't know if all the providers who are going to be using MyTurn will use that practice, but that is one way for people to do that. Otherwise, they could probably call the pharmacy and ask which vaccine they're using for those pharmacies that are participating in the federal program. So yeah, if one does want to shop for a particular vaccine, I think it will take a little work on their end to just figure out what is being offered at which clinic.
And again, as far as public health goes, every Friday at noon, that's when you release your appointments, and that's when everybody can go. And I put in the chat Actually, there's the list of all the providers in Nevada County, and also the URL for myturn.ca.gov. And if you are already vaccinated and you want to do something nice for your neighbors who are maybe not online, you can offer for them to go, and especially if you have a fast internet connection, Fridays at noon, you go and you log on and you register them, and maybe even book the appointments for them. So that would be good, because that way we can all expand our social circles, and you know, it's nice to be able to talk to the neighbors without masks on. That would be really great. However, before we get there, um, our chances are rather high that next Tuesday, the state will determine that we will have to go back into the purple tier with the associated restrictions that are with it. So that will, of course, again, impact people. It will impact the businesses. It will also impact, well, it impacts everything basically. And so what is the one thing that all of us can do to, if we have to go into purple, so that we get out of it as fast as possible?
I think that's how we started this conversation.
Yep. And
Right.
we're coming to the last
Yeah.
few minutes. So
It's masking, distancing, avoiding those gatherings, particularly indoors. That's what's going to stop the spread of the disease, as well as getting vaccinated. As Ryan indicated, so we ran the numbers yesterday morning, and if we look at the 16 and over residents of Nevada County, so those who are eligible, it looks like 23% of our eligible population is fully vaccinated. 16% is partially vaccinated. So let's get those numbers up. That will also help decrease disease transmission.
getting the numbers up is one thing, and then keeping the numbers of gatherings, etc. Keeping those down would be probably the fastest way for all of us to get out of it, because personally I really don't want to. I don't want to stay in the purple tier, though. I mean, I like purple, but I don't want to be in the purple tier, and especially having the state come in Nevada County would probably only create more of a backlash by a admittedly small portion of, well, Western Nevada County residents. And I got a few texts saying that public health is people basically thank all of public health, and then they say, well, but it's not like, well, let's put it, the city councils or board of supervisors are fully behind this. And that's the politics. Politics doesn't really belong into public health, even though the role of government is public health and safety. But politics doesn't really belong in it. And for now, let's all take personal responsibility, get vaccinated when eligible, and get your friends, your family, make sure that everybody's safe, and wearing a mask. By now, you know, even the slow learners, it takes we've been wearing masks for over a year, so we can do it a little bit longer for the common good, and to get rid of as much as possible of this pandemic. And also, it's probably a good thing for the next flu season to keep the masks around, because obviously mask wearing works, because we didn't have hardly any flu cases. As the last time I looked on the state's on the state database, no flu. So with that, I would like to thank Public Health. Thank you for coming. Thanks to our live audience, and thanks for your questions. And we'll do this again next week, and then maybe we'll have an update, and fingers crossed that somehow we'll still be in red, or at least on the way to get out of this. So with that, everybody, please stay safe. Thank you.
Thank you.
Thanks.
Thank you.
Thanks, Pascal.
Bye.